So in case you missed it, the CDC is currently being sued by 2 pediatricians, and there are a lot of takeaways in this lawsuit that parents need to be aware of. So let's talk about them. First, who are these doctors that are suing the CDC? Well, the first is Dr. Paul Thomas. You might have heard of him. He wrote a book called The Vaccine Friendly Plan. And the second is Dr. Kenneth Stroller. Now, there are 3 main points in this lawsuit that I want us to talk about. The first is they are claiming that the CDC has never evaluated the cumulative effects of all 72 doses that are currently on the vaccine schedule. Page 10 of the claim states that neither the FDA nor the CDC has ever required or conducted safety testing of the cumulative childhood schedule. So what they're saying here is not only are vaccines not being tested against inert placebos during their trials, they are also not being tested to see if they are compatible with the other vaccines that are already scheduled to be given that day to the child. And then furthermore, they are not evaluating the schedule as a whole to see if all 72 of those doses in the body are safe together. Then on page 12 of the lawsuit, they go on to talk about the Institute of Medicine's 2013 report, and they bring up 2 excellent points. They say that no studies have compared the differences in health outcomes between entirely unimmunized populations of children and fully immunized children. Furthermore, studies designed to examine the long-term effects of the cumulative number of vaccines or other aspects of the immunization schedule have not been conducted. So here we see that the Institute of Medicine was asking the CDC to do these studies, which is exactly what that first doctor, Dr. Paul Thomas, did. He evaluated within his own patients in his own clinic. He looked at the vaccinated versus the unvaccinated, and he published a study reporting what he found. Within 5 days of publishing that study, his medical license was removed. Second point in this lawsuit that we need to talk about is related to the CDC's Advisory Committee on Immunization Practices, or ACIP. When they recommend a vaccine, they can label it either Category A or Category B. When they label it Category A, that means that they think that it should apply universally to all children, as opposed to when they label it Category B, which means that shared clinical decision-making between the physician and the family based on individual circumstances is recommended. Now, it's important to note that almost every vaccine on the childhood schedule is currently labeled Category A. Now, this can mean big trouble for doctors who try to write medical exemptions for certain patients. It can cause them to lose their medical license. And that's exactly what happened to the second doctor in the lawsuit, Dr. Kenneth Stroller. So the third aspect of this lawsuit that we need to talk about are the biennial reports. So back when the 1986 National Vaccine Act was passed, there was a provision included that required HHS to submit to Congress every other year a report on vaccine safety. Now, guess how many of these biennial reports have been submitted to Congress since 1986? 0. So there's a lot going on in this lawsuit, and parents are definitely going to want to pay attention as it all unfolds and many things are brought to the light. Remember, if you'd like me to send you the vaxxed versus unvaxxed studies from Dr. Paul Thomas and others, or if you'd like a copy of this lawsuit so you can read through it yourself, just comment send and I'll send both your way.